Hello and welcome to this explainer video for Getz Clinical's Recovery Module. The Recovery Module can also be referred to as PACU, an abbreviation for Post-Anesthesia Care Unit, depending on your preference. This module is part of the GCC perioperative suite, which captures patients' procedural information and is openly interoperable with hospital patient administration systems. The GCC Recovery Module is accessed through a purpose-built medical-grade Getz Touch device, installed in each recovery bay and connected to the patient monitor. The system allows clinicians to enter patients' recovery assessments, medications, and fluids, along with continuous real-time monitoring of patients' post-op condition from the patient monitor. When the Getz Touch device turns on, it will default to the device configuration screen, allowing the user to confirm prior to running their first case that the location of the device, the patient monitor connected to it, and the network printer in the recovery nurse's station are correct. Scheduled procedures from GCC Bookings module or your own patient administration system are shown in the bookings list. This list can show plus or minus 7-day bookings, but will default to today's bookings for ease of use. Once a case is completed, it will be removed from the bookings list and can be viewed in the Show Completed Cases here. The status helps identify where the patient is within their journey. Green indicates that the patient is on the way from the theatre to the recovery, which has been designed to minimise incorrect patient selection. On the Confirm Patient Details screen, clinicians can review the patient's personal information relevant to their clinical care. These details flow automatically from the pre-op and intra-op modules into the recovery module. As a security feature, these fields are not editable. The Setup Case screen allows the receiving nurse to enter their details, see the procedure that was performed, and the anaesthetic technique details to prepare them for the incoming patient. The Start Data Collection timer enables nurses to retrospectively set the time at which the patient enters the recovery. This means the nurse can settle the patient and then start the case when they are ready. The case start time determines the start time of the case within the recovery, and vitals will be imported from the patient monitor from this time onwards. The main case screen in recovery has the same format as intra-op, so that all nurses and anaesthetists are familiar with the information displayed. The quick touch buttons, however, are different as they relate to the patient's recovery. The patients running medications, fluids and infusions from the intra-op module, as well as those administered in recovery, will be shown here. The pop-up message in the Case Notes field shows information about the patient's discharge status from theatre and can be acknowledged when the nurse is ready. The Assess button enables information about the patient's airway, consciousness, pulse and respiration, together with their nausea, sedation and pain, to be documented. This can be documented at multiple times throughout the recovery process. To ensure continuous care, the recovery module has a Postop Orders button, which enables clinicians to view and acknowledge any post-op orders that were added in the intra-op module. A Quick Add button enables the nurse to add the medications without possible encoding errors. Using the GCS and pupil buttons, the clinicians can quickly document the relevant care being delivered to the patient. The dermatome screen captures information relating to a patient's block and the patient's ability to move their legs, including circulation assessment. The wound management screen enables the documentation of single or multiple wound sites and detailed notes on colour, warmth, dressing type and sensation, as well as other observations can be made. Other buttons on the screen include artifacts for recording gaps in vitals and reasons for delays in the provision of care. The Ready for Discharge screen provides a fully configurable, consolidated screen for recording all discharge-related information. GCC uses the modified Aldrich Discharge Scoring system, which can be configured for the hospital's own protocol to highlight areas of concern. Checkboxes can confirm key elements of care have been achieved, documentation completed, and belongings have been returned to the patient. The text for these can also be configured to suit the hospital's own discharge checks. The discharge details will be recorded in the patient notes and on the printed report. When the patient has been discharged, clinicians can then tap the Patient Left PACU button. The system will present the patient's complete recovery report, which can be printed and can also be reviewed in the GCC Chronology module as and when needed. Thank you for watching. For more information, visit our website www.getzclinical.com, and remember, get better with Getz Clinical.